A very good morning to all of you. This is a fantastic day for us to talk about Medicina Futura. The name which is given Medicina Futura is so apt. Why it is so apt? I am going to give you a small introduction about what I am going to talk today. And this is all related to the fundamental research in homeopathy which is going on in the last 14 years. And here we were talking about nanoscale materials all along. But the most important thing which I wanted to highlight you today is about, this last few days ago, 2 weeks before, we have seen there was a Nobel Prize, the Nobel Prize was distributed for all the important branches. And in chemistry, the Nobel Prize was shared by three eminent scientists, Alexei Ekimov, Louis Bruce, and Monkey Bawendi. These three of them got Nobel Prize for a specific contribution, that is the discovery of quantum dots. So what is a quantum dot? Quantum dots are the smallest nanoparticles. Nanoparticles are 10 to 100, 1 to 100 nanometer scale is called nano. That means 1 by billionth of a meter or 1 by thousand of a micron. And in that smallness, it is generally called nano when the particles comes less than 10 nanometer in size. But in 1981, Alexei Ekimov, a chemical scientist in the USSR at that time, discovered the presence of particles which are still smaller than 10 nanometer and which he is the first person to call them quantum dots. Because they show the properties of electron and they show the properties of wave properties and also they show the properties of the matter in a very light level. And this was very important discovery because this is the year the Nobel Prize Committee has declared that for the discovery and synthesis of quantum dots. Why as homeopaths we have to be so proud about this Nobel Prize? Because the man who discovered quantum dots first in human history was Dr. Samuel Hahnemann. And I am going to substantiate that and I am going to show you the pictures why I said this. And here quantum dots are used for commercial purpose, especially for the LEDs. LED screens are brightened. This screen itself is brightened because of QLEDs, quantum LEDs. And this quantum light emitting diode technology is what they are contributed to the industry and for that they have received Nobel Prize. But my dear friends, these quantum particles and quantum dots are used by every homeopath in his clinic every day for treating and curing patients. And this is something which is beyond the thought of science all along. But now we are in that reality. And here when the matter shrinks to quantum phenomena arises, that depends upon the size of the matter. So one thing we should realize that when any material is reduced to quantum level, to nano level, their chemical properties will completely change. That is the reason why homeopathic drugs become non-toxic when you are using toxic material in the process of potentization. And here there are particles smaller than 1.5 nanometer. 1.5 to 10 nanometer is called quantum dots and there are particles nanometer which are not termed with any specific name which we are seeing plenty in homeopathic dilution. That means homeopathic dilution has three dimensions right now. The nano dimension, the quantum dimension and less than quantum dimension. And less than quantum dimension is quantum to atomic scale. That is quantomic scale. I can say that is what we can call as quantomic, quantum atomic. There less than 1.5 nanometer scale particles are plenty in many of the homeopathic dilutions. And therefore, a few of the pictures I will show you because our time is very limited and constrained. I will go a little fast. This is a HRTM image of platina 30C. You can see the size of nanoparticles, 8.2 to 12.7. Whereas platina 200, the size of nanoparticles are 0.69 nanometer to 3.01 nanometer. Well within the range of quantum dots. And this is my latest discovery and which is published in British Homeopathy Journal this current year. This is platina When you study additionally platina on SAED, you can find the platina is getting converted into platinum dioxide. So platinum become platinum dioxide, aurum become aurum dioxide or trioxide, and they become non-toxic. This is the quantum dimension of homeopathy. It is far beyond the nano dimensions. So my dear doctors, this is a HRTM image of platina 10M. You can see the scale bar 3.67 to 5.51 nanometer size. And you can see here the pictures. In the second picture you can see there are lines. These lines are the atomic arrangement of platinum. The atoms are arranged in a linear fashion. And when you go to ferrometallicum, you will find in the 6E of ferrometallicum, the particles are 5.39 to 24.8. And in ferromet 200, you can see 2.35 to 12.02. Why I am showing all these pictures of different, see the aurum metallicum 0.3 to 20. And when you go to LM1, it is 1.24 to 7.5 nanometer. And again you can see the aurum at 30, 0.27 to 2 nanometer scale. Natramurcium you can see 0.65 to 1.15. Sodium and chloride are in ionized form. They are purely in an atomic scale. And this is the reason why you use Natramur for a common cold to a long-term depression after love failure. Everywhere Natramur works. And even in a leukemia patient, Natramur works. Why Natramur works so deeply? Because the particles of Natramur in the drug solution of homeopathy is so small. It is in a quantum scale. It is less than quantum scale. It is in a quantum atomic scale. And that is the beauty of homeopathy. And the name which is given for today's conference, Medicina Futura, is highly justified because homeopathy is the science for the future. We are only the connecting link taking the message to the next generation. And I am very sure by the next generation, homeopathy is going to be an entirely different science. And this is the iodine 200. You can see 2.8 to 9.03 nanometer scale. This is a pure alcohol without any material in it. Why this is very important? Because when we look at the human system is composed of nanomaterials. You look at the DNA, look at the RNA, look at the enzymes, look at the receptors, antigens, antibodies. Every functional unit in the human body is in a nanometer scale. And when we go to the DNA, we know very specifically that DNA, RNA and its proteomics are completely organized in a nanometer scale. And this is where the homeopathy operates. In the genetic level, especially in the DNA, gene regulatory mechanism and genomics is where homeopathy works. And when it goes at its functional level, at the gross functional level of cell, and homeopathy is 100 times more advanced than any so-called conventional modern medicine in the therapeutic application. That is something we have to be very clear as homeopathic doctors, that will give us enormous confidence. And here the epigenetics, that is DNA methylation, histone modification, chromatin remodeling, can be done by things which are called epi-drugs in nanoscale. So homeopathic medicines are the epi-drugs in nanometer scale as well as in QD scale. So my dear doctors, what we are looking at the future is the whole medicine will vanish. I can tell you, I can assure you, in another 20 years, the today's medicine will not be there. It is going to be dictated by the new information in genetics, nanotechnology and artificial intelligence. These three are going to redefine the human health scenario within 1 or 2 decades. If we are lucky, we will see that. And homeopathy has a great role. So the present research finding says that homeopathy is a pure personalized quantum medicine, or you call it nanomedicine or nano-quantum medicine. And when we are taking a case in detail, we are extracting the genetic blueprint of a patient by the characteristics. Because every characteristic symptom we take up has a specific gene modification in our system. And it varies from individual to individual. And it is a time to realize that research papers and the book Nanodynamics. You can see this book was Nanodynamics. The second edition was very recently published by B. Jain. And many of the new drugs are added into that, and many of the new informations are also added into this. And few of the books are available in the counter. You can look into that when you are going out. And these are the important works which I have published, and these books are available. And in that scientific revolution, homeopathy is the true Medicina Futura. Thank you very much.
Thank you, sir. That was a very informative session. Now we move on to this second part of this. We are privileged and excited to have our next speaker, who is the Director Chairperson, Global Homeopathy Foundation in Australia, Dr. Michael Kusuf, MBBS, Consultant Homeopath at National Institute of Integrative Medicine, Melbourne, Australia. Please put your hands together and welcome our next speaker.
Welcome to this talk about rigorous homeopathic randomised controlled trials, number needed to treat versus number needed to interview. I'm Dr. Michael Kusef, Chairman of Global Homeopathy Foundation Australia. Why do we do randomised controlled trials? Well, if you have a statistically and mathematically exact, and one can expect them to be reproducible if they have been properly done and properly reported. The only way to disprove them is by demonstrating non-reproducibility. There are various, a number of researchers in homeopathy have, and one is that the randomised controlled trial does not allow good model validity for homeopathy. In other words, the restrictions of doing randomised controlled trials prevent people from applying proper homeopathic principles. In other words, a simillimum. They are too expensive and they are time consuming. However, the GHF protocol, which has just had its first pilot study completed with a sample of 280 practitioners, each admitting one patient, has overcome this problem. The average cost of a phase 3 randomised controlled trial in the United States for a pharmaceutical company is $20 million US. In Australia, if you were to do the GHF anxiety protocol that we've just completed, it would possibly cost only about $800,000 or $900,000, a lot less than this. Using the GHF protocol, the cost would be $40,000, so less than the cost of a lot of family cars in Australia. How do we do a study with minimal cost and inconvenience to participants? Well, if you look at the case of India, it has about 280,000 practitioners. If you recruit 0.5% of them, or in other words 1 in 200, then you would have a network of 1,400 practitioners who would be available for doing randomised controlled trials. Each practitioner just admitting one patient each, not a very onerous task, would contribute to a study with very large statistical power and conclusive results. No ifs, no buts, no maybes, no equivocations, as is the case with 30 and 60 and 98 sample size studies, etc. If we have a look at past research in homeopathy, the sample sizes have been small and therefore essentially don't prove anything. The study by Brigo in 1991 had a statistical significance in terms of its effect on treatment of headache. However, a very similar study done a few years later by Valak and his collaborators with a sample size of 98 produced no statistical significance. Neither study proves anything one way or the other than being pilot studies. In order to prove something, they would have to adopt multiple replicates of small sample size studies and then meta-analyse them, or just go ahead and do big samples to start with. And the GHF protocol permits this to be done rapidly and cheaply. Here is another study, very interesting study on small cell cancer in the lung, same problem. 98 patients is too small for a 3-arm study to prove anything definitively. And if you were to do this particular study on, let's say, 1,000 patients, I would say it was going to cost you millions of dollars to do it. Let's see what pharmaceutical companies do. In the case of the statins, vascular event, in the highest risk group was in the vicinity of 25. That means you needed to treat 25 people for 5 years with this pharmaceutical in order to avoid one primary outcome of cardiovascular events such as myocardial infarction. What was the sample size they used in this particular study, which was a cohort study? 4,513. So there are no small sample size studies for these people unless they're doing little pilot studies. Here is the 4S study, which looked at the action of the cholesterol lowering agent simvastatin. The sample size used in this double-blind randomized trial, double-blind randomized controlled trial in heart failure with reduced ejection fraction. This study calculated the 5-year estimated number needed to treat for primary outcome of cardiovascular death or heart failure, hospitalization versus ACE inhibitor. The number needed to treat was 14, so you needed to treat 14 people with this pharmaceutical for 5 years in order to avoid one primary outcome of the study, cardiovascular death or heart failure hospitalization. The sample size, 8,400. Now with homeopathy, what is the number needed to treat for homeopathy? Let's say you're doing a study in dysmenorrhea or migraine or pain in rheumatoid arthritis or whatever. If you have an ideal homeopathic prescription, most homeopaths would consider, you have a simillimum, you have an ideal prescription, very well indicated, would consider that the number needed to treat to get an effect would be 1. So in other words, you have a patient, you have an ideal effect. Now if the number needed to treat isn't 1, then it's close to 1. It's certainly a lot less than 14 or 25 or 400 as in some quoted in some studies. The problem with homeopathy is not number needed to treat, it's the number needed to interview, because if you take a homeopathic case and you give an incorrect medicine.
Third topic of this session, signature detection for enhancing the effectiveness of homeopathy. Our speaker is Dr. Nishant Nambisan, MD Gold Medalist, member of Faculty of Homeopathy Malaysia, FBIH London and MDP. He is a medico, an inventor and a techie with many accolades. He is also the principal investigator of the largest homeopathic study in association with WHO, AIMS, ICMR, CSRI. It is my proud privilege to welcome Dr. Nishant Nambisan.
Good morning, friends. So we will talk about this yes. So, taking you back to your classroom, let us once again see how Hahnemann discovered potentization, that is the method of dynamization. So, it caused undue, caused reactions, and so he decided to give low potencies. So, once what he found was that the medicines that were carried in the carriages, on the bullock carts and carriages, they worked better than the medicines that were simply diluted. So he ordered a a saddle, and on that saddle he started doing this. In the year 2008, Dr. Luc Montagnier of France got the Nobel Prize for discovering HIV. So this was the person who later published a research paper where he diluted the bacterial solution that were sterile, and that yielded electromagnetic signals where no bacteria was to be found. And this paper was based on the method of homeopathic dilution, homeopathic dynamization. In this paper, what this doctor did was that he took Mycoplasma pyrum and then he filtered that mycoplasma, and the fluid that was left behind was then serially potentized. And this, to his surprise, he saw that the potencies 5x, 8x and 12x, they were showing electromagnetic signals that were comparable to the electromagnetic signals emitted by Mycoplasma pyrum. So this was the device you can see here. This was the device where he used to put the diluted dynamized solution, and this computer would reveal the waveforms of the Mycoplasma pyrum in the highly diluted form where no bacteria was to be found. So this was in year 2011 where he patented this technology, along with the technology where he used the dynamization method. And to my surprise, this patent has no mention of homeopathy or no mention of Hahnemannian method of dynamization, and the dynamization process, the potentization process, was patented in the year 2011. So I was wondering if this can be replicated in homeopathic medicine system of medicine. That is when I collaborated with CSIR, that is the central government agency in Bhopal, wherein we developed this sensor which can detect homeopathic medicines and characterize it. So this was the sensor that we developed, which has coil, and this coil has a mu box. This mu box, actually what it does is it will separate the ambient electromagnetic signals that are there in the atmosphere, and mobile signals, and these can interfere. So we separated the signals from the atmosphere. So the electromagnetic signals was found in homeopathic medicines. And so as you all know that ferrometallicum is also already a ferromagnetic property element. So what about other elements like argentum metallicum, which is non-magnetic? So as you already know that ferrometallicum is a ferromagnetic, and other medicines like silver, argentum nitricum, they are diamagnetic in property. So diamagnetic means they will not be attracted to the magnet. So here you can see there are the different potencies of plumbum metallicum, ferrum metallicum, antium tart, alumina, zincum metallicum, argentum nitricum. They are different medicines, and in different potencies they emitted electromagnetic signals, and that were captured, and we are in the process of standardizing this method. So we saw that it was showing a logarithmic behavior, and due to this logarithmic behavior, it can be used for enhancing the quality of medicine and also controlling the quality of homeopathic medicines. So before you give it to a patient, if you can identify whether the medicine has the same quality or not, it will definitely improve the effectiveness of the rightly chosen medicine. You can see that the plumbum metallicum was one medicine which was giving the highest response, followed by ferrum metallicum, and then still followed by antium tart and argentum, zincum and alumina. So this was because of the associated natural property of the metal. So here you will see that there are several papers in physics, not in homeopathy, in physics, wherein they say that if lead is converted into nanoparticle, it will start behaving like a magnet. So that means if our homeopathic medicines are showing magnetic properties, ferromagnetic properties, that means it has been converted into nanoparticles, and only then they will show the magnetic properties if they are converted into nanoparticle microscopy to see if there were ferrum metallicum particles. So they tried different characterization tools, but this was the only tool wherein they could find the signature of the particular medicine. Recently, a scientist, Kohane, he discovered that if gold nanoparticles are injected into a rat with venous malformation, and phototherapy is done, then the venous malformation disappears in merely 2 days. So here the nanoparticle medicine is coming up in a very big way. The only thing that was done differently here in this study was that it was non-homeopathic, but it was followed by phototherapy. So this was a very good paper that has been recently published. So we have to rethink as homeopaths that whether we can also use some augmented therapy along with our therapy which can enhance the potential of homeopathic medicines. This was published recently in a physics journal, not in a homeopathic journal. A high impact factor physics journal, Material Science, Elsevier, published this paper and widely acknowledged by the scientific community world over. So you know that disease also changes the electromagnetic frequencies of cells and tissues, and homeopathic medicines are also found to be emitting electromagnetic signals in different conditions. So the similima principle here puts back the pathological pathways into physiological pathway thing. So this is the indigenous tool that we developed, and this is an experimental setup. We are now making it more better and trying to standardize it. So here there are different homeopathic medicines, and you would ask me a question whether you have done higher potencies of 30 to 100 1M. Yes, we are doing it. In the coming months we will be coming up with the results of those medicines also. One thing that I would like to emphasize here, that Luc Montagnier, who was a Nobel Prize winner, saw that if the medicines, homeopathic medicines or any medicines, if they have to follow this rule of dynamization, they are better prepared in diluted in water rather than other solutions. Second thing he told was never keep it freezing, because freezing will cause the medicine to deteriorate its effectiveness, and also the medicines kept above the temperature of 40 degrees Celsius will also lose its electromagnetic properties. So these are some caveats that you should also use in your daily practice. And before doing this experimentation, we also put these homeopathic medicines to vortexing, that is a special method of potentizing and charging, which enhanced the electromagnetic signals of the homeopathic medicines. As you can see, this was vortexed charged homeopathic medicines, and these were non-charged homeopathic medicines. So I will speak about this sometime later. Thank you very much for a very patient listening.
The next part of our session is on the topic Scope of Homeopathy in Tuberculosis Research by Dr. Chitra Chandrasekhar, has PhD in Human Genetics from Osmania University. She is also the Director of Dr. Airavardhan Clinical Laboratory, Hyderabad. We would like to invite Dr. Chitra Chandrasekhar. Welcome, ma'am.
Good morning. Good morning. I would like to express my gratitude to the organizers for extending this invitation to be a part of this August gathering. For me, it is a learning experience. Next slide. That one? Okay. Next slide. Diagnosis and treatment of infectious diseases has always challenged both microbiologists and clinicians in terms of early diagnosis and treatment, especially Mycobacterium tuberculosis. Recent advent of molecular techniques and early detection of MTB has become possible with culture. Now it can be detected within 48 hours with the advent of all molecular techniques. But given the limitation of conventional antibiotics and emerging drug resistance, it's of utmost importance. The latest to come in the diagnostic field is the whole genome sequence of M. tuberculosis complex. This has opened a new avenue to look into all the mutations which can be responsible for the drug resistance. Basically, all the new strains of MTB who has not been treated are sensitive to the first line drugs of the conventional medication. But MDR develops over a period of time. It does not develop in a day or at a moment. It has to have a sequential mutational exposure to the drugs, then it develops the mutation. Those mild mutations can be detected when you do the whole genome sequence. This is when the patient is not responding to the ATT. Now, coming to how homeopathy has given its importance, there's a wonderful paper by Dr. Kusum S. Chand presented at 65th Congress. She has done along with TB hospitals and the summary of the whole thing was ATT plus homeo medicines had a complementary effect in the sense, yeah. Sure, thank you. And tuberculum as an intercurrent remedy in active disease has shown promising results. And homeopathic intervention can supplement the existing regimen, resulting in improved outcome compared to only the conventional treatment. How they came to this conclusion was they followed up around 150 patients already on ATT with and without homeopathic medicine. It was a chronicity of the tuberculosis in varying degrees, suggesting that early intervention could have had a better outcome. Continuing, Dr. Praveen had done an in vitro pilot study on the effect of tuberculin 30 on the genetic sequence of a multi-drug strain of tuberculosis. Now, we had exposed the tuberculin 30 in different potencies to the control strain S37RV and also a multi-drug resistant strain. Should I methodologies? I'll cut short that. But what we found basically there was a change in the protein and the enzymes SNPs, that is single nucleotide polymorphism. Now, coming next to the further going with the immune responses, we wanted to see how household contact in TB patients react. Suppose there is an index patient in a home. At least the members who are exposed to these index patients, not all develop TB, but only few of the members can develop TB. So, we had done around 200 to 300 patients, both healthy controls and the household contacts of the TB patients, to check on 3 mycobacterial antigens, and we checked for interferon gamma and IL-23 and NK cells also. So what we found was there was a low expression of IL-23R in TB patients compared to healthy controls, indicating that he will be prone to TB infection. The next one what we checked was natural killer cells. These will be increased in healthy controls compared to the TB patients when they are PPD positive, MATO positive. When they are exposed, these are all the pilot studies which we are doing now. And the next one was interferon gamma. And here also we found that the interferon gamma is reduced in patients who are in the risk of developing TB. So coming to the further researches are what we can look in, which is in the offing with ICMR, which is being done at Bhagwan Mahavir Hospital now, are we are to take a long-term default, and that leads to drug resistance. And second thing, we are checking out on 3 types of vaccines in household contacts and following them for 3 years. Then vaccines, there are 2 types, one in the household contacts and one in already treated patients. Vaccines are being given to see if they don't get any relapse or the relapse rate is less. Usually the relapse rates in TB patients will be around 10 to 11%. We would like to know whether this rate can be controlled. In spite of all this, why TB burden in Southeast Asian countries as well as India is so high? This is why TB is not being controlled, though they have a vision to do it within 2025. Basically, transmission takes place in household, then the community, and then outside the community. So, and the most important thing is urban slums. They contribute around 30% of the TB transmission in an urban setting compared to villages and other, where there are less crowding. So when you visit an urban slum, you will find its poor ventilation and the risk factors, basically overcrowding and very poor economic condition. So basically, if we find out the hotspots are the clustering of TB cases in pockets of urban slum. So this is how the hotspots will be. But how do you identify a hotspot? We had done a pilot study by using geographical information technology. We went to how we found out that these were the hotspot is in any DMCs when the patients keep coming from a certain area. 1 minute? Okay. We identified that the household contacts are more in these hotspots compared to the other. So if we focus our treatment or our interventions in these particular areas, the amount of transmission can be cut down and TB can be arrested at least to a certain. How can homeopathy be complementary? More research has to be done whether homeopathy has an adjuvant, can act as an adjuvant, improve the immunity and also help in healing the lung tissues. Thank you.
Thank you very much, ma'am, for sharing your insights and expertise on tuberculosis research. The last topic of the first session is on Hashimoto thyroiditis, and our speaker for this session is Professor Dr. V. Satish Kumar. He is a celebrated homeopath specializing in treating mental and behavioral disorders including autism and ADHD. He is the professor and HOD in the Department of Repertory at Sarada Krishna Homeopathy Medical College, Kanyakumari since 12 years. It's my great honor to invite Professor Dr. V. Satish Kumar sir on stage.
Good morning to all. Today I am going to present on research related to Hashimoto's thyroiditis in the recent advances. In our Sharada Krishna Homeopathic Medical College, myself is in charge of that thyroid department. Last few years we are doing some work on that, and from which only I am going to present something regarding that Hashimoto's thyroiditis. Especially there is a clinical study to effectiveness of homeopathic treatment in Hashimoto's thyroiditis by thyroid peroxidase antibody level 1. Next is an anti-thyroglobulin antibodies level, and also in thyroiditis with vitamin D deficiency. I will explain in detail. Before that, there is an only just an introduction part only. I am telling that thyroid is a gland which is present in that neck region, in that in front of the larynx. It's a butterfly shape, right and left lobe, and it is an isthmus. Usually that is a function little because of homeopathy is related to mind, how it is influencing, and if you know that the physiology, then only you can understand the depth level of that. First of all, the hypothalamus is secreting thyroid releasing hormone, and it is coming into the pituitary, and it is also from other sources, and if depend upon that demand, the thyroid stimulating hormone is secreted, the normal value is there, and then it is coming into the thyroid gland, and from the thyroid to the iodine, and it is producing two hormones are there, thyroxine and triiodothyronine. The 93% is from the thyroxine, and only 7% is from the triiodothyronine. Even after that, thyroxine is converted into thyroidine also be there. Then for our purpose of that study, that is normally we are using that T3 and T4 level, but if you go deep level, that is you can use the free thyroid and free T3 and T4 level. That is very useful. And after that, then it is coming into the blood pool, and with the depend on that, it will coming into that pituitary gland. It will be monitored. This will be controlled. Then it is also very good action into the metabolism. It is the depend upon that the secretion of the thyroid gland only the metabolism is coming. The growth and normal growth, especially from the children. I will tell you one patient is coming from one that is infant coming to us, and that is always be that that infant is wetting that lips. On that time, there is one doctor from pediatrician she told that it is due to hypothyroidism. I sent the case for that, and on that time, that is at the THS service raised, I give calcaria got good result. So that is from that infant level itself, it is most important. Then directly I am the thyroid. Hashimoto's thyroiditis, name it is given due to because that is invented by a Japanese physician, it is Hashimoto. It is mainly the Hashimoto thyroiditis, it is otherwise known as chronic lymphocytic thyroiditis, or it is an autoimmune thyroiditis. So it is having main role in the autoimmune mechanism. There it is immune system is destroyed, so that end that thyroid gland is going into fibrotic stage. So here, depend upon that damage, this is an antigen, it is creating that antibodies. So we can measure that antibodies. Depend upon that, there is an antimicrosomal antibodies, or it is known as anti-thyroid antibody or TPO antibody. Here the best serological markers, it is into diagnosis. Normal value is less than 9 international unit. The thyroglobulin antibodies is another antibodies. It will detect the confirm that autoimmune thyroiditis, and is normal value is 116 less than that, 160. There is two things are very important. I will go in each and every. That is an antibodies level. It is having primarily, it is autoimmune thyroiditis, Hashimoto's thyroiditis there. The epidemiology, it is an international level. What I am telling is 0.8% 1,000 per. In women, it is normally the Hashimoto's thyroiditis is prevalent. Usually the women are, that is an middle age, it is in adulthood is a major, there is an Hashimoto's thyroiditis always be present. Then this first study, here we take 30 cases, from which I will tell that it is an nearly not audible now. Okay. In 30 cases, this is 57. It is a good moderate improvement, and it is an 33 in the marked improvement, and 10% is only the mild improvement is there. Mainly, we are getting in all the cases we have good result with the natrum muriaticum. It's 15 cases, calcaria carb 7. Lycopodium and phosphorus in 2 each, and the calcaria iodatum, RMet, arsenicum, aluminum iodine in 1 case. Here, especially thyroiditis, age group maximum it is affected is 40 to 45, and it is next is 23 to 35. Especially females, housewives are having 21 cases, and it is an lower class people started 15 cases. Natriuretic, I already told. Widely we are used in LM potency for we have good result is there. And it is improving gradually, we are increasing potencies are there. Commonly, there is common symptoms are there. There is weight gain, constipation, harshness of eyes, dry skin, and so many soreness of moments of cold skin. All that what I am telling is each and every cases we are going. I am the department of repetitive case study. We know that we are going into the deep level in that mental symptom and mental generals. There almost all the cases are having, mainly having this grief, anger, anxiety, and fear. In all their cases, if we are coming to that level only, we are coming into the remedy very directly. Here we got prominent miasm is an psoric miasm. Next study related to thyroglobulin antibodies level. Then here we got with good results are there. Only there is a marked improvement with 40%, moderate only with 13%, mild 10, no improvement with 37%. That is very new findings we got it. I will explain in detail later. We also come to the natriureticum in 11 cases. Calcaria iodatum is coming into that because previous calcaria carb is 5 cases, aromat, iodine, lactasis, lycopodium, phosphorus, pulsatilla, sepia, staphylococcus aureus in one each. Here, the 11 cases, natriureticum is in 11 cases, and calcaria iodatum is coming into the second level because because of the thyroid during the puberty. We find that 6 cases, so we got good result. And also this thyroglobulin antibodies in 12 cases moderately improved. Only that is with 4 cases only. But TSS level in almost all cases we are getting a good result with THS improvement. Marked in 10 cases, moderate in 12 cases, and mild in 7 cases. The higher incident, in this case we are maximum cases from the coastal area. Even it is available iodine is sufficient with even the 29 cases are there. And there is an emotional stress is only 13 cases, and history of viral infection and family history of thyroid only 7 cases. Most frequently probable then into the calcaria carb, phosphorus, then all these remedies are coming. Here, Hashimoto's thyroid is autoimmune disease. It is prevalent. Age group 31 to 35 years, followed by only 26 to 30 years. Females are predominantly affected, especially housewives are more commonly affected. Low socio-economic status in all the cases it is there. And the natriureticum is indicate the first grade remedy, and followed by calcaria carbonicum and phosphorus. Here is widely used LM potency in 56.6% cases. Commonly the symptoms I told that. Here another finding is there. In almost 2 cases we have got good, this mainly the sore eyes affected. Here we can get the psychotic miasm in 12 cases also. And effectively homeopathic medicines are proved THS level is there. Reduction level of thyroid antibodies in 23 cases. Another very important finding, that is when the thyroglobulin antibody level is increases, there is a rise in the level of anti-thyroid peroxidase level, vice versa. One is raised, another is down. Then reason remaining unknown, we are doing that for the further research. Vitamin D deficiency is present in 28 cases, one of the risk factor of thyroid. But we also with good result with even in the Hashimoto thyroiditis with vitamin D. Then now I am comparing with all these 3 cases. Sorry. Antibodies more prevalent in the age group 40 to 45, and in the second is 26 to 40, then in 31 to 35%. Averagely 30. Then households are mainly affected this. Here the high risk factor is a lower class people are 15, and middle class is there in that second study, that's the lower study. So that may very less in the high class according to our study. Here the natriureticum is highest remedy, second is a calcaria carb, third is a calcaria iodatum. Here there is a marked improvement cases. Here maximum we are get good result with the LM potency, 50%. Here our second is 33% and 56%. The vitamin that deficiency, I got good result with 1 potency also, 30 also. Here that is an ailments from. In almost all cases, we are get good result with the grief. So the natromere is coming into the top. There are 6 cases in the first study, second 10 cases and 9 cases, remaining anger, anxiety and fear. So the mental journal is having highest role in that prescription of there. Here, all the study, SORA is predominant. On the last study, vitamin D, the psychotic also be a predominant. Mayasam is behind it. Inference. Action of homeopathic medicine in the microstomal antibody has a very good result, but comparing with the anti-thyroglobulin antibody, there the result is reduced. There only we got, there is no improvement with 33% of cases. So that is another one study is there. Then the research is ongoing, elicit the action of medicines on thyroglobulin antibodies. That is, now we are planning in another 30 cases with this thyroglobulin. Why that thyroglobulin antibody level is not reduced? That we are doing the research now. And vitamin D deficiency is present in 28 cases, and one of the risk factors of Hashimoto's thyroiditis. Normally, if we are thyroiditis, we are treating, lifelong treatment is needed from the modern medicine. But in homeopathy, with our constitutional remedy, we tried with, always we are tapering the medicine and coming to the normal level within that few years. The hypothyroid state and the deep acting constitutional medicines are proved effective, especially the natrum muriaticum, calcaria carp, lycopodium, phosphorus, so on the remedies. These are all that. Thank you very much. Before that, we are also doing and so many other research on that. Now we have a tie-up with Rajiv Gandhi Center for Biotechnology. Our PG students and ourselves, we are doing. And on that, we got very good result with the homeopathic scientificity. But in another occasion, that on that time we will prove that, and also what are the available science in which we are doing so many researches on that. Thank you very much. Thank you very much for giving me the opportunity. Thank you.